Everyone, welcome to this special broadcast on some frequently asked questions on COVID, and we shall also try to decode the second wave of the pandemic in India. I have got a very eminent set of panelists tonight with me. Joining me live from Newcastle in the United States is Dr. Jayanta Biswa Sharma, a consultant microbiologist and infectious disease infection control specialist at the National Health Service. I am also joined by Dr. Madhumita Priyadarshini Das. Madhumita Priyadarshini Das is Professor of Medicine at the Guwahati Medical College Hospital, and I am also joined by well-known clinician Dr. Bharat Bhushan Kukreja. Ladies and gentlemen, welcome to this special broadcast coming to you at a time when the country's COVID situation is absolutely alarming, with daily cases hovering around the 4,000 mark and daily death toll hovering, of course, around the 3,500 on an average. And closer home in Assam also, the COVID situation is grave, with the daily cases almost touching 5,000. And in Guwahati city also, the COVID cases are almost racing towards the 2,000 mark. And what is surprising is that compared to the first wave, in the second wave, now the daily death toll has shot up to 41 yesterday. This is an all-time high. Ladies and gentlemen, in view of this grave crisis, we have this top experts on the virus, or top experts on COVID. Will try to answer some of the most frequently asked questions. First of all, I'd like to go to Dr. Jayanta Biswa Sharma, joining me, as I said, from Newcastle in the United Kingdom. Dr. Jayanta Biswa Sharma, the first question which everybody wants to know, was India taken by surprise as far as the second wave is concerned?
I cannot quite hear you.
Okay, my question is, was India taken by surprise? Was India taken by surprise?
Okay.
That is my first question.
Yes. India was taken by surprise because India thought that COVID has gone forever. We have basically suppressed COVID and we are isolated, so COVID has gone. But if you remember, the last time we spoke about COVID, I actually predicted that cases are going to rise from May, June. I was actually wrong in the sense that I said May, June. I didn't anticipate it would rise from April, but I was right by and large, because rise in COVID only to be anticipated, because it is we have seen its seasonal pattern. So rise was only to be expected, because in the England as well, with the autumn and the cases start rising in autumn and obviously gone to the roof by winter. So it was only to be expected. So only region India was taken by surprise because it didn't think that it was a seasonal disease.
Absolutely. Now, Dr. Jayanta Biswa Sharma, did we fail to learn from our experiences around the world?
I think Indian experts thinks they are in a silo. To me, looks like, are they learning from worldwide experience? I don't know that, because first of all, they failed to anticipate that cases would rise. If you remember, I was so optimistic in our show in last January, beginning of the year, that India started its vaccination program right in the opportune moment.
Right.
All we needed to do is to get a maximum coverage by April, May time, and we miserably failed in that. And some of the vaccine skeptics were none other than the doctors themselves. So I think it is a matter of same, in that regard.
All right, let me turn to Dr. Madhumita Priyadarshini Das, Professor of Medicine at the Guwahati Medical College. Dr. Madhumita, compared to the first wave, this time around, during the second wave, we are witnessing many an increased number of deaths, increased number of fatalities, and that is also the case with Assam. Why do you think there has been so many deaths this time around?
Yes, Wasbir? Wasbir, that's a very pertinent question that you have brought up. Yes, we have been noticing a lot of deaths this time. And not only that, the mortality has been higher in the younger age group because, as our microbiologist friend, Dr. Jayanta Bishwa Sharma, will probably agree that these viruses have a tendency for mutation. That is how they survive, actually. So the new mutant strains have been found to be very virulent. Number one, that means they spread very fast from one person to the other. And number two, the amount of disease that
Right.
they cause in a very short span of time is also huge. And as we always knew that COVID causes clotting of blood vessels or blood in the blood vessels in the small microvasculature of the major organs. And that has been one of the major causes of sudden death this time. Besides that, of course, the cytokine storm, which we had noticed in the last year, the first phase of the pandemic, is also another reason. But this time, I think it is more of the microvasculature causing clots, resulting in sudden death because of cardiac dysfunction or brain dysfunction. I mean, it's kind of unfolding. That's what we are observing till date. Doctors in Delhi or Mumbai would know better, but what we have
Okay.
seen as of now, that's one of the major reasons of sudden death in young people.
Now, let me turn now to Dr. Bharat Bhushan Kukreja. Dr. Bharat Kukreja, you are a private practitioner. You are one of the well-known clinicians in the city of Guwahati. Now, my question to you, Dr. Kukreja, is that a lot of doctors, a lot of medical experts running hospitals in Guwahati are saying that people with home isolation, or for that matter, people with COVID symptoms are coming much too late to hospitals. They do not earlier. They used to get themselves tested and come directly to hospitals, but this is not the case now. Even this morning, in a leading city hospital, 3 people were brought dead. That means they're saying that they were having fever and etc. and symptoms for the last 4 to 5 days, but they come to hospital late. Is this one of the reasons? Do you think people have started taking COVID lightly compared to last time?
It's a paradox now. We were learning in the last phase, we learned that not all people who have infection of COVID need to be hospitalized. And we were not able to put everyone in a hospital for all the care. And the guidelines said mild to moderate patients should be monitored at home under medical care of healthcare providers. Now, unfortunately, instead of healthcare providers, they are not following the instructions which have been very clearly given to them, like using when not to continue staying at home and when to move to the emergency department, emergency room, or get the patient admitted. So it is not that people are dying just because they are not getting care, but they just don't think that they would require to go because they have not looked at it. Now, if you don't look at it, how can a doctor help it or a healthcare provider help it? It has clearly mentioned at what point of time one should cut off. And the same breath, I would like to tell that not all people who are at home, they get penalty and go and block a seat, which would have otherwise been given to those who genuinely require admission. So one has to learn to be disciplined to follow healthcare providers' advice of moving to the emergency room. This is the message which I would like to carry, that follow what is to be done and otherwise do not panic. Most of the people would recover, although 3 people died today, but there are any number of people
Yeah.
who are now recovering. Over.
Do not panic. Do not panic is the message coming from Dr. Bharat Bhushan Kukreja. Dr. Jayanta Vishwa Sharma, is is there is there truly any specific treatment for COVID-19?
Okay, Jare, yeah, there is no specific treatment for COVID-19. For mild disease, there is no treatment for COVID-19. The treatment prescribed in India is really not evidence-based. Only for severe COVID, when somebody is on ventilator requiring additional oxygen support on an ICU, that kind of patient benefit from steroid. Apart from steroid, there is no treatment for COVID. I mean, there are some monoclonal antibodies being tried, but evidence are not solid. And remdesivir is not a treatment for severe disease. That is completely out of question. There is no evidence in favor of remdesivir. Even for mild disease, there is no evidence for remdesivir, but people are using it, which is not cost effective. In the UK, we stopped using remdesivir since the Solidarity trial was published. I think it is in November time. The moment report came out, we stopped using remdesivir. And
Right.
just, Jari, let me make a comment about this mutant strain. The strain has mutated, and that given
Wasbir.
its the ability to Wasbir, to spread more efficiently. But the strain hasn't become any more lethal. That is the point to be noted. We must be very careful in attributing deaths to COVID as well. Many deaths are occurring. COVID probably is an incidental finding. Probably COVID symptoms were not there in the first place. I think we have to be very careful. And a few anecdotal cases where we are citing that young people are dying, we do need solid evidence that they are dying from a COVID-related complication like clotting and so on. If I would say the increased death that we are seeing in India, maybe because of mismanagement, I think we have to bring that angle in as well. The public is panic stricken. The hospital beds are, for sure, I know in my personal experience, occupied by less severe patient. And one bed occupied by a less severe patient means denying that bed to a
Right.
patient who genuinely
Right.
require it. I think there is a lot of mismanagement going on. Private hospitals are
Okay,
minting
let me
money.
take this.
They are occupying
Right.
their beds with less severe patients.
Right. Now, Dr. Madhumita, ICMR has been constantly evaluating the situation. Now, we have something called the Indian variant. The virus has been mutating in the last 1 year or more than 1 year. Now, are steroids being overused? Is there a treatment protocol laid down by the ICMR? A lot of people would want to know that. Or does it change from hospital to hospital? Does it change from state to state? What is the treatment protocol? Is it something which is very clearly stated by ICMR?
Yes, Wasbir, we do have a very standard protocol for treatment of. Yes, Wasbir, we have a very standard protocol for treatment of COVID. And as per that protocol, the major difference between what was happening last year to what is happening this year is that from our last year experience, we realized that early use of steroids is not indicated in COVID. Early use of steroids increases the viremia. It kind of delays the clearance of the virus. So now we are using steroids much later. We are using steroids after the end of the first week or beginning of the second week, unless the patient is very critical in the early part as a life-saving drug. Otherwise, we are using steroids later. We are using steroids at a lower dose, and we are using steroids for a shorter period of time, so that the viremia is not prolonged by the use of steroid, but at the same time, the what you call the immunologically active substances which are released as a part of the cytokine storm that sets in the body following the COVID infection can be tackled by the steroids, which are our natural hormones that help us to tide over any crisis in the body. So it's used later and shorter,
Okay,
not as it was next day.
I'll come back to you, Dr. Madhumita. Right. Right. Now let me once again go to Dr. Kukreja. Dr. Kukreja, as a clinician, what are your observations on COVID patients from the first phase to now, that is the second phase? Is there any difference? What has been your observations?
Okay, very quickly, if I recall, in the initial phase, in the first 4 months, we spent just on learning what is COVID and what should be what is the disease like, and it almost took us 5-6 months. When the guidelines came from the Ministry of Health that we can manage patients at home who are mild or moderate, we started venturing into managing these patients at home because by that time it was very clear that at home you can give the same benefit of recovery as you do in isolation hospital or in a COVID hospital. Soon after October, November, when we started doing this, we got very good results. But we started having a post-COVID complication patients, which included people with a lot of psychiatric problems, a lot of lung problems, and GI problems. And hardly we were able to start putting them in the category that we had this second category, second wave, wherein we are seeing instead of an index patient in the family or in an area, the entire family, including a 5-year-old child, 3-year-old child, the 90-year-old grandfather, all members are involved. Now this has become a big challenge for us because what do you do now? So we have now learned that whether it is a single patient at home or the whole family being involved, there is no reason to get into a state of shock that what has happened, we are all going to now perish. Nothing like this. People call and say, sir, I have a 90-year-old father, what will happen? Well, there are people we have in Guwahati who were treated at home, incidentally because they didn't get a seat at that time, but he is 98 years doing very well. So the learning for us is that we should be able to make the patient understand that this is the cutoff level. Beyond this, I would not allow you to stay home and I'll ask you to go to COVID hospital. Otherwise, follow all the rules and all the directions as being given by a healthcare provider, not by a WhatsApp group or by by all the other means. So this is what we have learned, that behave in a disciplined manner as a patient, and as a doctor, there's no hurry to write a prescription which is photocopied and circulated, that give it to everybody. And I have seen inadvertent use of steroids, which being used early is causing more harm. Then if I do not use it, I would not cause so much of harm. So this is the lesson which we have picked up in the last 1 year or so of COVID learning.
Right. Now, Dr. Jayanta Biswa Sharma, if you have heard Dr. Bharat Bhushan Kukreja is saying that, patients should not panic and doctors also should not be in a hurry, and there is no similar treatment. I mean, the same prescription need not be given to everybody who complains or who suspects that he or she has COVID. Now, my question, I've got a specific question for you. A lot of people abroad are talking about a drug called Ivermectin, which is an anti-helmintic. Now, do you use it at all? Because at one point of time in India, a lot of people are saying that, we should use, chloroquine and so on and so forth. So now, what about this drug? A lot of people are talking about a lot of new drugs now. Ivermectin is one of them.
Yeah, I think these are old drugs, and we're trying to repurpose them. That is the kind of word we use, repurposing old drugs for newer challenges. But to be honest, there is no evidence for ivermectin. There are a few anecdotal. I think that is the thing my colleague in India need to learn. Don't use anything that hasn't been actually established in a clinical trial. Don't do harm to the patient. Not doing harm is the first dictum in medical profession. Last time it was chloroquine. This time it is ivermectin. This time, the remdesivir. I get really worked up emotionally. People are spending a lakh of rupees, 40,000 per vial on remdesivir, which doesn't work. I think I perfectly agree with Dr. Kukreja. I mean, not to panic, and the doctor not to medicalize a condition which is essentially self-limiting. No, I mean, we are seeing more serious cases because we are getting more infections, but proportionately, number of serious infections are coming actually down. If you take into account the number of cases, yeah, you have to take the percentage, isn't it? Because we are getting absolute numbers is higher, that doesn't mean the bug has become lethal. Because percentage-wise, mortality hasn't gone up. In England, cases gone up 12 times. Mortality didn't even go up twice. Right. So why in India we are seeing mortality proportionately going up with the cases? I think it is a scandal. It is a scandal. It needs proper investigation.
Absolutely. I'll have to go for a break, but before that, very quickly, Dr. Madhumita, we are talking about treatment. Now, what about CT scans and X-rays? Do you think people are running to the X-ray centers to get a CT scan done to check the chest, whether your lungs is infected? Is this doing more harm than good? Yesterday, Dr. Guleria, the director of AIMS, was saying that don't do CT scans unnecessarily. Don't do CT scans unless specifically advised by medical experts. Don't do CT scans unless specifically advised by medical experts.
That's very true, Wasbir. It's a double-edged sword. CT scans will, of course, pick up lung infiltrations pretty early, even before a normal X-ray would. But the point is, if you subject young females or even young males to CT scan rampant right and left, and many people in India, as you know, the protocol is, they can just go and ask for a CT scan themselves. It's always not mandatory for a doctor to write a CT scan for them as it is in the developed countries. So
Right.
that is doing more harm than good for sure. But there does come a time in the course of the disease when we clinically suspect that there is enough of lung involvement and we want to know the magnitude of the lung involvement, then we of course do ask for a CT scan, and we have a scoring on the CT where we can tell exactly how much of lung damage has happened. I mean, it's a score out of 25. So someone who's having a 21 score will need more rampant treatment than someone who's having a 5 or a 6 score. But the treating doctor is usually competent enough to decide the timing of the scan. This time, unfortunately, people are coming to us with a negative report of COVID RT-PCR, but they've already done a CT scan. And sometimes the CT scan is showing damage as well. So there is a gray zone there. But
Yeah,
even
absolutely.
without damage, people are doing, young people, 20s, 30s, they're doing a CT scan and coming to the doctor that, see, this is what I have, cough, cold, I have done a CT scan, I have done this and that, and that's how they land up. So that's doing more harm. That's something we have to be alert. Wait for your doctor to ask for the
Absolutely.
investigation.
All these things, all these things appears to be nothing but panic reaction out of lack of information or lack of information on the net for the layman. I think that is doing more harm than good. Don't go for anywhere. I'll be back after this very short break and ask several more questions to our eminent panel tonight. Welcome back, viewers. There is a breaking story at this point in time. Breaking news. Assam Health Minister Dr. Himanta Biswa Sharma has just tweeted the new cases in Assam in the last 24 hours, as I said, is hovering around 5,000. The new cases in the last 24 hours is 4,826. Viewers, 4,826 fresh cases across Assam in the last 24 hours, out of which in Kamrup Metropolitan District, that is Guwahati and its vicinity, it is 1,383, with a positivity rate in the state now stands at 9.27. That's indeed high. 9.27% is the positivity rate, and there has been 55 fatalities, 55 deaths in the last 24 hours. Once again, I'm telling it, viewers, Dr. Himanta Biswa Sharma has just tweeted. He said that the new cases in the state in the last 24 hours is 4,826. In Kamrup Metropolitan District, it is 1,383, and there has been 55 deaths with a positivity rate of 9.27%. That is indeed a cause for worry. That is indeed a cause for worry, viewers. And let me go to our panelist on this very issue. Dr. Kukreja, you know, 4,826 fresh cases, almost hovering around 5,000, with a positivity rate of 9.27%. Do you think the people are largely responsible? Do you think the people have become extremely casual about the COVID situation?
Yeah, I'm very sorry to hear the statistics which you have just given us, given from our Honorable Health Minister. Blame game is stop it. We are all together responsible. It is not the public alone. It is all of us. Did we really do it together? We did not. Everybody was pushing it on the other one. How can we achieve it? There's a small example. Bhutan decided to do something, they did it, and they are an example. We did not want to do it because we were more busy with ourselves rather than our country and our people. So I would not say that blame a thelawala or a rickshawala. It is in the family. A building which there are 20 floors. All people, almost everywhere in each floor is involved. Now whom to blame? So I think it is enough is enough. We got to now make it to the point and do all the best to make them understand that there is only one way, and that is in a prevention of further hastening of this spread. Because 9.27 last week it was, last 2 days back it was 10%. So this is between 9 and 10%. So it is our collective responsibility, all of us, healthcare providers, general public, teachers, social workers, that we got to make everyone understand that we got to do all the basic protocols for saving ourselves and saving others from getting infected. Over.
Absolutely. Now this brings us to the question, Dr. Himanta Biswa Sharma, what has been your experience in the United Kingdom? Now, a lot of people, there is a mini lockdown in Assam. There are lockdowns in different states in the country. Now, the central government is not in favor of a complete lockdown like it was in the first phase. Now, my question is simple. Do you think lockdown is a solution? Do you think lockdown can break the chain?
I'm going to give you that answer, but let me quickly, very quickly, make few points. You know, in India, there are a lot of mutants, not the Indian double mutant, but even the UK so-called Kent mutant is very widespread in India. In India, essentially, there are a number of mutants circulating in different parts, and that is not a big deal. Virus mutates. That's the way with every single virus, you know. So that is, don't too much worry about mutant. Okay, coming to the numbers, I'll come to the lockdown. About the numbers, you know, before this wave started in India, you know, last 3 weeks we have been having cases around 300,000. I think one day it touched 400,000 as well. But what is interesting, the India's position in the league table of the countries is still way in the down. You know, it is 114th in terms of cases per million. It is 113th in terms of mortality per million. So when you hear these 3,000, 2,000, 4,000 numbers, please take that in the context. If you remove the context, this number sounds like a big number, but these are not big numbers. Take the context. Okay, does lockdown work? No, lockdown doesn't work. Nowhere in the world lockdown worked. Lockdown only can work in a very specific situation if you are in a beginning of an outbreak, of a new outbreak, like we were in March time last year with Corona. Yes, lockdown was tried. That was a good thing to do, but we failed. One, the genie is out of the bottle. One, the horse has bolted. Don't blame the public anymore, because it is not because of the rickshawala, thelawala, as Dr. Kukreja said. Ordinary people not to be blamed. Do I blame a tsunami on Prime Minister of Japan? I don't. Neither I blame Japanese people for that. Then why we are blaming a natural phenomenon on poor public? Whatever you do, such a contagious respiratory virus cannot be contained. Where is the evidence for it? If I am to be very like a surgical in my argument, then if I ask where is the evidence for mask, you would be struggling to find evidence for mask. But it makes sense. What is the harm in wearing the mask, even if it gives me a little bit protection, or if I can protect you, So that makes sense. So we should be doing that. But if you ask me, if you challenge me, Dr. Sharma, show me the evidence,
Right.
I will struggle. If you challenge me, Dr. Sharma, produce the scientific evidence for lockdown, I would struggle. This is the bottom line. You have to wait. The epidemic curve goes like
Right.
that. It would
Right.
reach peak and it would subside over.
Right. Now let me turn to you once again, Dr. Madhumita. Slightly different question, which a lot of people want me to ask you. Is this, is there any link between COVID and heart attacks or cardiac arrests? Because there are a lot of reports of COVID patients. They're okay. He was detected positive for COVID-19, but ultimately died of a heart attack. So how do you explain this? Is there a link?
As I have already discussed, in the previous part of this discussion, that COVID, once a person is infected with COVID, there is a tendency for the blood to clot abnormally in the small blood vessels of the body. And that is the rationale behind using a drug called low dose heparin, which we use in all patients once they are tested positive for COVID, so that it is a drug which is, in a general man's term, it's a blood thinner, as they say. So we use a blood thinner in COVID patients to prevent the blood getting thick and clogging the small blood vessels here and there. That is one of the prime reasons why many young people are dying of sudden cardiac death. They are having myocardial infarction, heart attacks, as you have just mentioned, Wasbi. That is the reason. That means the small coronary blood vessels that supply blood to the myocardium or the heart vessels get clogged. And that is the reason why we are trying to prevent it with low molecular weight heparin. But some patients are coming late, as we have said, and that is the reason for the mortality. If actually heparin needs to be started way early in the course of the disease. If heparin is started late, a patient has come to you with a saturation of 60%, 70%, 75%, day 6, day 7 of the disease, they were quarantining at home, and then you start this drug. Yes, you have started, but the effect is not achieved, and there are already microvasculature coagulations, and within a day or two, maybe a person can develop a heart attack and a sudden cardiac death. So the bottom line is, come early to the hospital instead of
Right.
panicking,
Now,
staying back at home.
Now, this brings me to the question, Dr. Kukreja. Dr. Kukreja, when should you opt or not opt for home isolation? Now, how does someone with COVID symptoms decide whether he or she should stay at home or go to hospital? Who takes the decision?
Okay. It is the patient who takes the decision after learning when to take the decision, how to take the decision. So you need to have a tool. One thing is very clear, which must be which I tell my patients, and I want everyone to tell the patients, this COVID virus can turn into a severe inflammatory disease into the entire whole human body. What we see in the lungs is because lungs are hugely perfused, but similar things happen in the heart, in the kidneys, in the brain. With that, I ask them to measure their oximetry, they see their oxygen saturation, and cutoff point is very clear that if the oxygen saturation starts falling below 94, please contact me. And we do not allow them to go below 90 because that is the point where we then try to help them out at home and see if they respond in about an hour or two by doing prone ventilation, by giving increasing breathing support. If they cannot, then that is the time. And the second category is those people who are already having uncontrolled severe diabetes, obesity, hypertension, ischemic heart disease. They have got various cardiac ailments, or very fragile and very old people. These are the people, if they start having respiratory difficulties or become very restless, this is the time that they should be moved to an emergency room for further management by a specialist unit and not home management anymore.
Right, right. Now, let me go to once again to Dr. Jointa Biswa Sharma. Another thing, which is debatable, because now the government of India has said people for intra-state travel, healthy persons who wants to travel from one state to another unnecessarily need not go for RT-PCR test because that gives unnecessary pressure on the laboratories. Now my question is not that. My question is it necessary for a negative RT-PCR report to discharge a patient from hospital?
Not at all, not at all. Once you are genuinely RT-PCR positive, you got a COVID disease, then the remnant of RNA of that particular virus could persist in your system for up to 90 days. This is my daily experience here, because we follow, unlike in Indian doctors' experience, who do not get to actually follow cases, for it until its logical conclusion. We are lucky here in the sense that every patient is kind of in our system. I know I'm following patients for years and years. So I know, and it is in the literature out there as well, RT-PCR remains negative for 90 days, up to 90 days. Are you going to keep those patients like quarantined or restrict their civil liberty and so on? It is total nonsense. These are residual RNA, and very low level, they are positive at the cycle threshold of 35, 36, or even near to 40. And we are branding them as positive and not discharging the patient and curtailing his civil liberty. It is simply nonsense, No follow-up RT-PCR should be done as a test of cure or a test of infectivity. There is no role for repeat RT-PCR. I mean, if a patient is very well on ventilator, if you want to see his monitor his viremia, then of course you may like to do, but it is not a routine epidemiological means that you would be repeating RT-PCR. Just coming back to cardiac death, to be honest, I haven't seen in literature that COVID is anywhere linked to higher cardiac death or sudden cardiac arrest. If this is happening in India, then something to do with the demography maybe. But I think before I we need a detailed research, to be honest. Every single cardiac death labeled as, as a complication of COVID needs to be actually analyzed in a very thorough manner. But I would say the panic would cause in a vulnerable patient with already 80%, 90% blockage in the artery. If you put him to a panic, through panic, I mean, that is sufficient enough to precipitate a heart attack. I think we have to be very careful before we say that COVID leads to increased heart attack.
Right. Now, Dr. Kukreja, Indians, we are known for our, innovative medical or medicines that we use, alternative medicines. Now, a lot of people are thinking, take steam inhalation le lo, haldi doodh pee lo, kara le lo, steam inhalation, haldi doodh, some kind of kara concoction of various stuff. Does this thing help? That is the simple question a lot of people would like to know.
This is a $1,000,000 question. The answer is find out, is it causing harm? You can't make the people of our country and our fellow human beings believe in our system. There are many who just say that we are the killers for this COVID mortality. So, first question is ascertain, is it causing him harm? There are people who have taken all this. We have seen they have developed toxic effects. So therefore, as a allopathic treating physician, I tell them I have no idea, but kindly do not exceed the limit which has been prescribed by an Ayurvedic or alternate medicine specialist. So that is the way I try to make them understand. There are people who are taking everything. Well, to cure, if you can't cure a disease, give all an antibiotics would not take away the infection. This is a stupid way of approaching the disease. But of course, respecting the alternate medicine and their benefits. Only one thing in the alternative medicine is I strongly recommend, follow and practice is pranayam, breathing exercise. That is what is validated and agreed upon by WHO as well as Ayurvedic and homeopathic and everything.
Right. Breathing exercises, that is something which you can go for without any worry. That is only going to give you some help and support. Dr. Madhumita, now the vaccination process in India started on the 16th of January. Lot of people, starting with the healthcare workers, have already got the second shot, second jab. They have already got, including common people, some of the common people have also got the second jab. But the question is, even after taking 2 shots of vaccination, lot of people are still getting hit by COVID for the second time. So is it a cause for worry? Does it raise a question mark on the vaccines itself?
Wasbir, that's a very important point you have raised, and I'm very happy you've asked me that. No vaccine in this world is 100% protection against any disease. And our vaccines, Covaxin and Covishield, as far as I recall, have proven to be 70% effective. The Pfizer vaccine is supposed to be 90%. But all these vaccines have been made on a fast track. They are very efficacious, I'm sure. But like all other vaccines, no vaccine is 100% protection. That is something to be kept in mind for all diseases, not COVID alone. And those people who are getting the disease after the 2 shots of the vaccine, I mean, at least after 15 days of having taken the second shot, they are well protected, and the severity of the disease in those people are definitely less than the ones who are not vaccinated. So that is the additional edge that you get of having been vaccinated properly on proper time and having completed the schedule.
Right. Let me turn to Jayanta Mishra Sharma. Dr. Jayanta Mishra Sharma, lot of people are also saying that the vaccine the vaccine process started last year. So when the vaccine manufacturers were going about producing the vaccines, the second wave in most parts of the world had not arrived, and the vaccine had the virus had not mutated. So perhaps the vaccines some of the vaccines are not able to read the later variants. Is there any credence to this? Do you think that affects the efficacy of the existing vaccines?
The simple answer is no, because in the UK and worldwide, people are keeping a very, very, sharp eyes on these mutants, whether any of them are actually escape mutant. We call it escape mutant, the mutant that would not be
Yes.
covered by a particular vaccine. So they are, except for the South African strain, which is capable of escaping vaccine to certain extent, So far, none of the mutant has been identified as an escape mutant. That is a very good news, but that doesn't tell that in future a new mutant would not arise. But there's a very funny things, you know. The more pressure you put on the bug, on the virus or on the bacteria, you are putting them under selective pressure. So it is only to be expected that a mutant would arise in future, which would escape our vaccine. So we have to be on a one step ahead, actually, keeping an eye on the mutants and so on. So it is a game essentially with the bugs. And you know, in terms of vaccine efficacy, I very much what Dr. Madhumita said. That is what it is. The vaccine never claimed that it would be 100% efficacious, but it attenuates the disease. And another thing it does, it reduces the transmissibility. If I am vaccinated and if I got the disease for second time, I would not be transmitting it to you, you see. Transmissibility goes down as well. So benefit of vaccine is twofold, therefore. I mean, threefold. One is the absolute protection. Second is, even if you catch it, you would not be transmitting it. And the third one is that the disease would be very mutated in your case. It would be a very moderate, mild disease, even if you catch it.
Okay, that's a very, right. Right. That's a very important point said by Dr. Dr. Jayanta Biswa Sharma. Dr. Jayanta Biswa Sharma is saying that the vaccine is actually gives you a threefold protection. First, after the second shot and after 15 days after taking the second shot, if you get COVID again, the attack will be very mild on you. Secondly, you might not even get it at all. That means it will give you complete protection. The third is you will not infect others. So there is a win-win situation if you take the vaccine. But finally, I have very little time, Dr. Bharat Bhushan Kukreja. Lot of people are using double masks in the second phase. This is a noticeable feature in the second phase. We have seen people using double masks. Now, does that help better? My final question to you.
If I quote Professor Sharma, as he was saying, that if you ask for scientific evidence, you can't give evidence for everything. But it has been agreed by ICMR and then within the guidelines that in the present time, when we believe there is a transmission through air, if you are going to a market, fish market, sabji market, or fancy bazaar big market, it is better to put on two masks because most of the time we are not sure about the efficacy of one mask. So all the people are not able to buy N95 masks. The general public is therefore advised that if you are going out for any compelling reason, first thing is don't go out unless necessary. But if you are going out, better instead of one, put on two masks which are properly fitting. So I have no reason to tell people not to put on two masks, at least at the present scenario, if they are going out.
Right. Absolutely. Absolutely. My final question, last word to you, Dr. Madhumita. You know, I mean, why, when do we need oxygen support? Is it only do we need oxygen support only when the saturation level goes down below 95 or below 90, as Dr. Kukreja said? Or do you think it is always important to check the oxygen saturation level, which will mean that everybody today in this COVID backdrop has to buy and keep an oximeter ready?
I didn't really understand what you meant by everybody. It means basically a COVID infected person, once in home quarantine, should be monitoring their oxygen saturation periodically to see whether it's on a dropping trend. If it's on a dropping trend and if it comes below 94, they are asked to be hospitalized so that they can be given oxygen from outside. But that doesn't mean a normal person who is not COVID infected, just because the pandemic is on, keeps monitoring their oxygen. So that is also something that I have noticed among people who come and tell us. I don't know if you are hinting at that question. Did I get your question right? Wasbir, did you ask me that?
Yes, more or less. Yes, yes.
Yeah, so that's it. I mean, if you're COVID infected,
yes, I asked you almost that
quarantine,
question. Thank you.
yeah, oxygen, but don't panic. Don't panic.
Don't panic. Don't panic is the call by these eminent medical practitioners tonight. Dr. Jayanta Bisha Sharma in Newcastle, United Kingdom, then Dr. Madhumita Priyadarshini Das and Dr. Bharat Bhushan Kukreja in Guwahati. Thank you very much indeed for your time and for throwing light on some of the often asked questions as we are hit by the pandemic reaching an alarming proportion. And as everybody said on the panel tonight, don't panic, stay on guard, don't blame anybody. It's an issue that the common people alone cannot take the blame. And as Dr. Jayanta Bisha Sharma said, India was definitely caught unawares with the second phase, or perhaps they did not realize that it is going to be so vicious. This is, we are going to continue on Notice Live with this discussion on COVID and throw light on many do's and don'ts of this pandemic, or for that matter, this virus. Thank you very much, our panelists, and thank you very much, the viewers, for watching the show. Good night and goodbye.